Did you know your liver works to keep your body clean and balanced, yet most people don't notice the warning signs when it's in trouble? In this video, we'll go through 10 early signs your liver may be damaged and what you can do right now to protect it. Stay until the end, because number 9 and number 10 are often missed even by doctors. Yellowing of skin and eyes. Jaundice, sign of liver damage. When your liver is healthy, it filters bilirubin, a yellow pigment formed when red blood cells break down. But if your liver cells are damaged or your bile ducts are blocked, bilirubin starts to build up in the blood. This excess bilirubin deposits in your skin and eyes, making them appear yellow. Common causes of jaundice: hepatitis A, B, or C infections, fatty liver disease, especially non-alcoholic type, cirrhosis, scarring of the liver, gallstones or bile duct blockage, excessive alcohol use, certain medications that stress the liver. Other symptoms that often come with jaundice: dark urine, tea-colored, pale or clay-colored stool, itchy skin, fatigue or nausea, abdominal discomfort, right upper side. When your skin or the whites of your eyes turn yellow, it means your liver isn't doing its main job, clearing toxins and bilirubin from your blood. It's one of the clearest warning signs that your liver might be in trouble and needs medical attention. Feeling tired all the time, even after a full night's sleep, chronic fatigue and unexplained muscle weakness can be an early sign of liver trouble. When the liver isn't working well, toxins and metabolic wastes build up, inflammation and hormonal changes sap your energy, and your body can't store or release energy properly, all of which make you feel exhausted. In advanced cases, this contributes to hepatic encephalopathy, which ranges from subtle fogginess to marked confusion, to inflammation, the sickness behavior. Liver disease often triggers systemic inflammation. Immune molecules called cytokines can cross into the brain or act on it indirectly and produce sickness behavior, fatigue, low motivation, and malaise even before other clear symptoms appear. Research shows cytokine signaling plays a key role in fatigue seen in chronic liver disease. 3. Energy storage and metabolism problems. The liver stores and releases glucose, glycogen, and helps regulate overall metabolism. When it's damaged, the body's ability to release steady energy decreases, so you may feel weak or get tired faster during daily activities or exercise. Chronic liver disease is also linked to mitochondrial dysfunction in liver and muscle cells, lowering cellular energy production. 4. Muscle loss, sarcopenia, and weakness. People with chronic liver disease frequently develop sarcopenia, loss of muscle mass and strength. Fewer muscles and reduced muscle function make ordinary tasks harder and increase fatigue. Sarcopenia also worsens overall metabolism. Also, impaired nutrient storage like vitamins and low albumin levels can contribute to poor energy and physical weakness. 6. Sleep disruption and daytime tiredness. Liver disease often disrupts sleep architecture. People may be sleepy during the day or have poor nighttime sleep, which amplifies chronic fatigue. Changes in melatonin metabolism and nocturnal wakefulness are commonly reported in liver patients. How it typically feels: you're exhausted after light chores, you struggle to concentrate or finish tasks, exercise leaves you drained for hours, you have muscle weakness that didn't used to be there. What doctors check: liver function tests, ALT, AST, ALP, bilirubin check, liver cell injury and bile flow, albumin and clotting inner, assess liver's synthetic function, complete blood count, CBC, looks for anemia or platelet changes, serum ammonia if confusion or encephalopathy suspected, imaging, ultrasound, elastography when structural disease or fatty liver is suspected. Abdominal pain or swelling, early sign of liver disease. 1. Why it happens: your liver sits in the upper right side of your abdomen, just below the ribs. When the liver becomes inflamed, enlarged, or scarred, it stretches the capsule, a thin covering called Glisson's capsule that surrounds it. This stretching causes pain or discomfort in the right upper abdomen, sometimes dull, sometimes sharp. 2. Common causes of liver pain or swelling. Fatty liver disease, NAFLD or alcoholic. The liver becomes heavy and enlarged due to fat buildup. Hepatitis A, B, C, etc. Viral inflammation makes the liver tender and painful. Cirrhosis. Scarring blocks blood flow through the liver, causing pressure and swelling. Liver congestion. When the heart fails to pump properly, blood backs up into the liver. Congestive hepatomegaly, ascites, fluid buildup in the abdomen due to poor liver function or portal hypertension causes a visibly swollen belly. 3. What is ascites? Fluid swelling. Ascites is fluid accumulation inside the abdomen. It occurs when the liver's blood flow is blocked by scarring portal hypertension. The liver stops making enough albumin, a protein that keeps fluid inside blood vessels. As pressure builds, fluid leaks into the belly cavity causing visible swelling or bloating, tightness or discomfort, shortness of breath if fluid presses upward on the diaphragm. 4. What it feels like. People with liver-related pain or swelling often report a full, heavy feeling under the right ribs, tenderness when pressing that area, bloating that worsens after eating, swelling of the belly, which can increase over days or weeks. In advanced cases, ankle swelling, fluid traveling downward. If you ever feel pain or tightness under your right ribs, or notice your belly looking swollen, don't ignore it. Your liver sits right here, and when it's inflamed or scarred, it can swell and cause that pain. A healthy liver filters toxins and regulates fluids, but when it's damaged from fatty liver, hepatitis, or cirrhosis, pressure builds up, and fluid can leak into your abdomen. That's why your belly might look bloated or heavy, a condition called ascites. If you notice swelling with yellow skin, dark urine, or fatigue, see a doctor immediately. Your liver may be warning you before it's too late. Dark urine and pale stools, signs of liver disease. 1. Why these changes happen. Your liver's job is to process bilirubin, a yellow pigment produced when old red blood cells break down. Normally, the liver converts bilirubin into bile, which flows through the bile ducts into the intestine. Bile gives stool its normal brown color. But when the liver or bile ducts are damaged or blocked, bilirubin can't reach the intestine, so stool becomes pale or clay-colored. Instead, bilirubin leaks into the bloodstream and is filtered by the kidneys. Dark, tea-colored urine. This combination of pale stool plus dark urine is a strong sign of bile flow obstruction or liver injury. But when the liver or bile ducts are damaged or blocked, bilirubin can't reach the intestine, so stool becomes pale or clay-colored. Instead, bilirubin leaks into the bloodstream and is filtered by the kidneys. Dark, tea-colored urine. This combination of pale stool plus dark urine is a strong sign of bile flow obstruction or liver injury. If your urine suddenly turns dark brown, or your stool becomes light or clay-colored, your liver may be sending a serious warning. Normally, the liver sends bile into your intestines, giving stool its brown color. But when the liver or bile ducts are damaged or blocked from hepatitis, fatty liver, or gallstones, bile can't flow properly. That's why bilirubin builds up in the blood, darkening your urine while your stool loses color. Don't ignore these changes, they often appear before yellowing of the eyes. Get a liver function test right away and take care of your liver before the damage worsens. Nausea and loss of appetite, signs of liver disease. 1. Why it happens. The liver plays a major role in digesting food and removing toxins. When it's damaged or inflamed, several things happen that disturb digestion and appetite. Bile flow is reduced, so fats and nutrients aren't digested properly. This leads to nausea, bloating, and a feeling of fullness even after small meals. Toxin buildup like ammonia irritates the brain's vomiting center. This creates constant nausea or even vomiting. Inflammation and metabolic stress from liver injury affect the hypothalamus, the part of the brain that controls hunger. Result loss of appetite, especially for fatty or heavy foods. In advanced cases, ascites, abdominal fluid compresses the stomach, making patients feel full quickly. What patients often notice: constant or morning nausea, loss of taste or food aversion, especially to oily foods, feeling bloated or full after a few bites, weight loss without trying, sometimes vomiting or bitterness in the mouth after eating. If you've been feeling nauseous, can't finish your meals, or have lost your appetite without reason, your liver might be the reason. A healthy liver helps digest food by producing bile and clearing toxins. But when it's inflamed or damaged from fatty liver, hepatitis, or alcohol, toxins build up. bile flow slows down, and digestion suffers. That's why you may feel constant nausea, bloating, or fullness after just a few bites. Don't ignore these signs, especially if they come with yellow skin, dark urine, or fatigue. Your liver might be asking for help before it's too late. Itchy skin without rash, a sign of liver disease. 1. Why it happens. Your liver normally produces bile, which helps digest fats and remove waste. When the bile ducts are blocked or the liver is damaged, bile can't flow properly. This condition is called cholestasis. As a result, bile acids and other waste products build up in the bloodstream. These substances deposit under the skin, irritating nerve endings. This leads to intense itching, even though there's no visible rash. The itching is often worse at night, making it hard to sleep. It usually affects the arms, legs, palms, and soles, but can occur anywhere no rash or bumps are seen. But the skin may show scratch marks from constant rubbing. Heat or stress can make it worse. Swelling in legs and ankles, a sign of liver disease. 1. Why it happens. Your liver does more than detoxify, it also helps balance body fluids by producing proteins like albumin and maintaining blood flow through the veins. When the liver is damaged or scarred, cirrhosis, several things go wrong. 1. Low albumin levels. The liver makes albumin, a protein that keeps fluid inside your blood vessels. When albumin levels drop, fluid leaks out into surrounding tissues, especially in the feet, ankles, and legs, where gravity pulls it downward. 2. Increased pressure in liver veins. Portal hypertension. Scarring in the liver increases resistance to blood flow. Blood backs up in the veins, causing fluid to build up in the lower body and sometimes the abdomen, called ascites. 3. Hormonal and kidney changes. As the liver struggles, the body releases hormones like aldosterone and AD, which make the kidneys retain salt and water, worsening swelling. 2. What it looks and feels like. Swelling, puffiness around ankles and feet, often worse at the end of the day. Pressing the area may leave a temporary dent. Pitting edema. Shoes or socks may feel tighter. Sometimes the swelling moves upward to the legs or thighs. It's painless, but legs may feel heavy, stiff, or tired. Bad breath and body odor, signs of liver disease. 1. Why it happens. Your liver's main job is to filter and detoxify the blood. When it's damaged from hepatitis, cirrhosis, or fatty liver disease, toxins and metabolic byproducts begin to accumulate in the bloodstream. These chemicals can escape through your lungs, sweat, and skin, leading to unpleasant smells that are difficult to mask. 2. Fetor hepaticus. Liver breath. One of the classic signs of severe liver dysfunction is called fetor hepaticus or liver breath. It gives off a sweet, musty, or decaying odor, often described like raw fish or rotten fruit. This happens because the liver fails to break down compounds such as dimethyl sulfide, methylmercaptan, and ammonia. These volatile substances enter the bloodstream and are released through the lungs when you breathe. This type of breath is especially common in advanced liver disease or hepatic failure, but milder liver dysfunction can still cause a similar bad breath pattern. 3. Body odor and sweat changes. When toxins and bile acids build up, the skin and sweat glands also start eliminating these waste products. The result is a strong, sour, or musty body odor that doesn't improve much even after bathing. T may be more noticeable in areas where sweat collects: armpits, neck, back, and chest. Your liver is a silent hero. It detoxifies your body, stores nutrients, and keeps your metabolism running. Oh, if you notice any of these warning signs, don't ignore them. Visit your doctor for a liver function test and focus on a healthy lifestyle. Avoid alcohol, eat more fruits and vegetables, and stay active. Take care of your liver, it takes care of you. If you found this video helpful, hit like, subscribe, and share it with someone who needs to see it.